Now, we have to go on to other organs of the body, like you were saying, 1 millimeter. Even though, let's say, I have breast cancer or even liver cancer or things like that, like I want to do it on my liver, but once you hit radiation, doesn't it also affect the other organs of the body as well at that part, or how do you manage that?
Right. That's the beauty of a modern radiotherapy machine like this.
Okay.
You can do something called conformal radiotherapy or IMRT, intensity modulated radiation, or VMAT,
Okay.
which is even more, more advanced technique of radiation. The first step you do is you do image guidance. A machine like this will take a picture of the patient, and you align the patient accurately before you start treatment. Now, when you start the treatment, the inside, and you can't see it on this machine because it's all built internally, there is something called a multi-leaf collimator.
Okay.
There is a leaf that interdigitates, okay, and that moves to shape the tumor, follows the shape of the tumor, okay? So as the machine rotates, and you can't see the rotation because it's all internally, it changes its shape. And at each different angle, it takes just the shape of the tumor. And you can see, when you see normal structure, it shields it. When it sees the tumor, the jaws open up and delivers the radiation. So it does this, at about sort of one cycle. It does four rotations per second. Per second, 4 rotation. So it's very, very, very quick. And the leaf changes shape so that the radiation is confined to that specific target. So we try to minimize the collateral damage.
Okay, right. So now let's go on, because doing research, and if people are going to research about radiotherapy, there's a lot of things they find online. Now, one of the first things I found is this study, or this thing where they're saying radiotherapy actually contributes to lymphedema.
Okay. Like I mentioned to you, when I started my career in radiation therapy, we use very crude methods. Now, lymphedema is seen mainly in breast cancer, where the surgeons have removed the lymph nodes in the axilla or in the armpit, and then we add radiation, and the radiation dose is pretty high in the armpit.
So this is like a secondary dose compared to the...
So when you've already damaged the lymphatic system, you add further insult to the system, and the circulation in that particular arm decreases. Patient starts to complain of swelling in the arm. Nowadays, I hardly see lymphedema. We, with good radiation techniques, surgical techniques, and we don't irradiate lymph nodes that has already been removed, we hardly see lymphedema.
So, final question, Dato, is radiotherapy, does it affect, is there a lot of, increases the chance of higher other health problems in time? And what about fertility and people who are pregnant and things like that?
Very important. We do not give radiation if you're pregnant.
Okay.
Well, for pregnant, especially in the early first trimester.
Okay.
It has, it can damage DNA, it can damage the fetal cells, and it can cause a lot of, fetal development problems. Yes, it can cause fertility. Depends on where we do the radiation. Say, for example, I have a young lady with a cancer of the rectum, and I need to treat the pelvis. The ovaries are there, and so the dose of radiation that I give can ablate the hormone production and can later cause fertility issues. And similarly in men, if it's close to the testes, you can cause fertility issues. What about all the other organ damage? Well, it can cause damage to the other organs, but you try, like I say, avoid normal tissue. Okay. Say, for example, when you're treating the breast, when you're treating the breast, you will inevitably treat a little bit of the lung, or sometimes even the heart is in the way. You have to be careful to avoid or minimize the treatment to the heart or to the lungs. And by doing that, you can avoid the long-term complication. If you treat too much lung, it will cause lung fibrosis. And in the long term, patients will have respiratory problems. If you damage the heart, you will weaken the heart. And in the long term, and when I talk about long term, it may be more than 5 years or 10 years after radiation, you may have complications. And we have seen this in some of the older techniques. Also, we have to be careful when treating young kids. Yeah? So when you're actually treating the spine or the bone, you can slow down the bone growth. So they will not grow normally. So they have a stunted growth, they will have unequal growth if you're treating one side of the limb. So all these things have got to be taken into account and explained to the patient. So we try to avoid giving too much radiation to kids, especially when they're growing up, or even to babies, up to 4 years old. We don't want to irradiate the brain because it can cause mental development problems later on, because you will cause brain damage if you give radiation high dose to little kids, especially before they are 4 years old.
Okay, all right, Dato. Thank you so much for your time.
Thank you.
Thank you. We'll be back right after this. This is Health Matters with me, Dishan Kumar.